Well, first of all, good morning, and I would like to thank Ian and the organizer for the very kind invitations. There's no denying him, I am an academic. So one of the criticism of academic is we can be far away from the reality. However, I've been working in the field of biocides for quite many years, and hopefully I've been interacted with people like Ian and manufacturers and so on. So I hope that I'm not too far away from the reality. Now, the role of an academic, as I say it, is to challenge preconceived ideas to questions. And here we'll questions about disinfectant efficacy, but also to educate. So I hope from this talk then you will get a better idea of the challenge in using those disinfectants and why they fail. No, I've been given the title Prevention of Hospital-Acquired Infections, but early on in my talk, when I said what I wanted to talk about is really what's simple, is does surface disinfection work? And I guess some of you in the field, frontline hospital, they probably know that surface disinfection does not always work, or rarely work, because you still got infections, you still got outbreaks of nasty pathogens. And the question is, why do those surface disinfection work, especially when companies come to sell their products? They've been tested with European standard. They can demonstrate they've got 5 log kills, so 99.99% reduction in pathogenic microorganisms within 5 minutes. So why do those products fail? So what I'm going to talk about very briefly, 20 minutes is very short, is a surface disinfection, but especially try to give you the idea about all the parameters that will affect the activity of those products. And those are pretty important when you use them in the field. So we'll talk about limitation of activity, and I will refer to a couple of studies, one done by Mark Wilcox on Clostridium difficile, and one we've done on MRSA as well in hospitals. I'll give you an example of failure of surface disinfections and consequences. And I'll talk very briefly about alternative to liquid disinfectants, especially those new products. You've all seen them, those antimicrobial wipes. And then I will conclude. So, I mean, first of all, surface disinfection. Where do we use surface disinfection and what it's for? Basically, it's really to prevent microbial transmission from the environment to the patients, to the staff, on trying to curb out cross-infections. So it's really from the environment to hands, where you use, for example, hard surface disinfection for controlling the transfer of microorganisms from patient to patient, healthcare workers to patient, and so on. That's hand hygiene or use of hand rubs, so it's quite different. But also it's prevent the transmission from medical devices to patients, to healthcare staff, and so on. And here you've got the use of, for example, of disinfection or high-level disinfections for example, endoscopes, but also the use of disinfections for other type of devices you will use in patients, like blood pressure cuffs and so on. So basically, disinfection or the use of biocides is very important and is very widespread, as you probably would know it. Now, what is the principle for activity? How a disinfectant, or I will refer to them as a biocide, how do they work? Why do they work? Well, first of all, it seems very simple, and I apologize if it's too simple, but you need to have a contact between the target microorganisms and the antimicrobial. Now, it seems simple, but it's a very important concept. And I guess some companies sometimes I deal with forget about that concept, especially some company developing some certain type of product where the contact between microorganisms on their antimicrobial product is not very obvious. So when you've got the contact, then it needs the biocide, the active molecule needs to penetrate the air and reach the target site. On the difference between biocides and antibiotics, and Neil will talk about antibiotics after me, is the main difference is that biocides got multiple target sites against the microorganisms. And the number of target sites that are affected on the importance of those target sites will give you a cidal activity, that means a killing effect, a lethal effect, or a static activity, an inhibitory effect. And I like to show this slide on that exactly demonstrate the activity of a biocide, in this case chlorhexidine, with the cell. And those are Pseudomonas stutzeri. And this is, for example, 5-minute contact, and you can see those blebbing around the cells. After 15 minutes, you're starting to have the cells dying. Here, the plasma membrane on the content of the cells pouring out of the cell wall. Here you've got really unhealthy cells and damaged cells, and after 60 minutes, they're all dead. But that just demonstrates that when a biocide works, this is the type of activity you have. You've got really the killing of the microorganism. You need a contact. So bioavailability concept is very important and depend on concentration, exposure, sustainability. If you haven't got those, you don't have bioavailability of your biocide, or you don't have activity. So a very simple concept, but as I said, some companies just forget those concepts, and their product, as a result, doesn't work, or they don't work very well. Now, the other important things about biocides and the use of those products is you've got a number of parameters that will affect the efficacy of the biocide or your disinfectant. You've got parameters that affect the product themselves, such as concentration, type of surface, and so on, and then factors that derive from the microorganisms. I'm going to list them very briefly and point out the very important one. So on this table, I list the factors that are inherent to the product itself. Concentration, to me, is the most important factor. If you've got a very low concentration, then it will have a profound effect on the efficacy of your biocide. Now, depending on the biocides you have, if it's, for example, a phenolics or QACs or a biguanide, an hypochlorite, a peroxygen, and so on, then the effect of concentration or a reduction of concentration will have different effect. For example, for phenolics, a small drop in concentration in your product will have a profound effect on activity. And this can be measured in the lab by what we call the concentration exponent. That's a measure of the efficacy of the product when you dilute the product. Type of surfaces are extremely important. So when we're talking about hard surface disinfection, if you're using your product on a hard surface, on a porous surface, you're going to have lots of difference in activity. Organic load, extremely important as well. Certain products like biguanide, QACs will be deeply affected by organic load. Temperature, it's maybe not something you think about, but usually when you decrease the temperature, then the efficacy of your product will decrease. Then pH, it's really a problem of formulation of the product. Contact time, it's a key factor as well, because usually the surface disinfectant that are being sold to you worked within 5 minutes. I mean, that's a European norm, but the way you use it, you're probably going to use it for 30 seconds on the surface. So do they work within 30 seconds? And then for gaseous biocide, and you see more and more fumigation or deep clean, then relative humidity will be very important. But among all those factors, the one in those red boxes are, for me, the most important when we talk about surface disinfection. Now, factors affecting efficacy, but factors deriving from the type of microorganisms is very important. So, for example, if you want to curb a staph aureus are probably easy to kill by any type of disinfection. But when we're looking at a Pseudomonas or a mycobacteria, those are much tougher to get rid of. The number of microorganisms, the more number you have, the harder it's going to be to be killed. But that number is often very difficult to predict. Phenotype, it's something you don't hear often about, is basically how fast those microorganisms are growing. I mean, if they're on the surface with lots of nutrients, like in feces, vomit, and so on, where they can really feed nicely, then they're likely to grow very quickly and be killed very quickly. However, if they're on the surfaces with no nutrient availability, then those growth of those microorganisms will be very slow. And as the result of that, they're not going to be killed or affected by the biocides very well. Again, locations, extremely important as well, if they're in a crack, for example, or some surfaces. But here I put example of tissue surrounding, for example, implants. Those will be very difficult to reach by any type of antimicrobials. Usually those factors like phenotypes and locations are not really considered at all when we're doing testing for efficacy.